Assalamu alaikum. I, Dr. Muhammad Akram, Department of Eastern Medicine, Government College University, Faisalabad. Uses of clear job descriptions clearly explains what each worker is expected to achieve, prevents arguments between people, prevents gap and overlap, can identify area for training, serves as a basis for evaluation. However, they should be used flexible guidelines rather than too strictly or literally. Thus, workers should be ready to help with one another's work when necessary. तो अब आप खुद देख लें कि जो है हम लोग एक दूसरे की कितनी मदद करते हैं. Using norms and standards. A job description does not say how much a healthy worker must do or how well. Norms and standards translate health objectives and targets of health teams to amounts of work and quality of case expected. They can be applied to work performance, productivity, and behavior. Number of deliveries conducted by the ENM, birth complication rate, performance over time can be used to compare workers. However, workers cannot be regarded as machines. With predetermined production mechanism, they can set their own standard. आप वर्कर्स को कभी ये ना समझें कि वो मशीनें हैं. वो वर्कर्स हैं, उन्होंने अपने लिहाज से ही काम करना है. Conducting meeting. Regular meeting of health teams are necessary to make decisions on a new project or educational activity. Preparing for a meeting. Purpose. Brief summary of what is to be achieved or agenda. Subject. Each person should have as much information as possible about the subject to be discussed. Type and size. Small or large. Invited only or open. Formal or informed. Place, time and durations. Who is convening and organizing. Announcements about the meeting. A good meeting is successful communication. The success of a meeting depends on quality of communication. If the purpose was to pass on information or explain sometime, the speaker should ensure whether this has been successful by questions and discussion. If the purpose was to seek views, the chairman should summarize the views and obtain agreement. The most important thing in communication is to bear what is not being said. Controlling time in meeting. Questions and discussion should be kept to define definite time period. If decision cannot be reached within time limit, it is advisable to postpone the attempts, which gives more time to think and prepare. अगर आप कोई मीटिंग कर रहे हैं और किसी डिसीजन तक नहीं पहुंच रहे तो उसको पोस्टपोन कर दें और लोगों को सोचने दें, सोचने का मौका दें. Committee rules and procedures 3. Order of business. Chairman calls meetings to order, announces names of absentees and their apologies, introduces new members, recognizes guests. Secretary reads previous meetings minutes. इस तरह हमारे जो है ना जनरल की भी बहुत मीटिंग्स होती हैं जिसमें सेक्रेटरी साहब जो है वो पुरानी मीटिंग की जो है मिनट्स पढ़ते हैं. तो हम उसकी एग्जांपल लेकर ये इसको अच्छी तरह याद कर सकते हैं. Members propose addition or correction to minutes. After all modification, chairman moves to approve minutes. Voting take place and approved. Discussion proceeds according to agenda items and decisions made on each item. Training staff. The human resources are the most expensive forms of health resource, hence they should have high standard of performance. Purpose of training: to improve competence, maintain a positive attitude towards work, to reduce sense of inadequacy, to ensure that community gets quality care. Training strategies: continuing educations, a system that gives opportunity to continue learning both for personal care, career and benefit of health services, help to adopt performance to new development, still inadequate in many countries, carried out in piecemeal. In service training is associated with supervision, service and problem related, concerned with local needs, deals with training needs as they arise, deals with problem solving in the healthcare, training focused on priority health care problems. Training procedures, process, training need analysis, training objectives, training delivery, training evaluation. What are training needs for this person and our jobs? Objectives should be measurable and observable. Techniques includes on the job training, action learning, measure reactions, learning behavior and results. Assessing training needs. Task analysis, a detailed analysis of a job to identify the skills required so that an appropriate training program can be instituted. Competency analysis, careful study of competency level to identify a deficiency that and then correct it with a training program or some other development interventions. Competency analysis, current competency level of the employee. Competency gap, competency assessment, required competency level for certain position, training and development program. Assuring competence of health teams, selection and recruitment, assessing competency and competence and performance in service training approaches, relating the training system to health care. The educational process, defining learning objectives, setting criteria and designing methods for assessing achievement, selecting learning methods, organizing learning experiences, providing conditions in which active learning can take place, developing and using training resources, reinforcing learning experience with supportive supervision. After the objectives and duties of health team have been defined and team members carefully selected, trained and instructed, control measures can be advised to ensure that the team's work program proceeds as expected and maintain expected amount and quality of work. Controlling and maintaining work standards, necessity to ensure that work is done according to the objectives and within the allotted time and resources, to enable supervisors to identify deficiencies in workers' abilities and arrange for proper training, to enable supervisors to recognize and reward good work and recommend for promotions, to ensure that resources are adequate and properly used, to enable identifications of causes of work deficiencies. Good control should be timely, simple, minimal, flexible. Assessing work performance based on clear statement of objectives that are relevant, feasible, measurable, and agreed by the workers. Determine the level of achievement by the team. Purpose of assessment is to help discover the strength and weakness of workers and the potential for growth and further training needs. Assessment should be continuous. Supervisors must help workers to respond to helpful criticisms and improve performance. The immediate supervisor who sees the health workers most often is the best person to make the assessment. A checklist is very useful. Thank you very much.